Knee pathology is really limited to those injuries specific to the knee itself versus injuries that are going to involve the patellofemoral joint. So when we talk about knee pathology, we need to think about the ligament injury classification. And within the knee, we use the term instability instead of laxity. Laxity referring more so to joint play. Hughston et al. In 1976 described injury classifications for those ligament injuries. There are straight plane injuries, medial, which would be your MCL, lateral, LCL, anterior, ACL, and posterior, your PCL, or obviously there can also be a combination of any of those ligaments. And then there's rotatory, including your anteromedial, which would include ACL and MCL, anterolateral, ACL and LCL, posterior medial, which is your PCL, MCL, and your posterolateral PCL, LCL. Within the straight plane, we start with the medial. The medial is going to be a MCL sprain. When we assess an MCL, we're going to use a valgus stress test. And we're going to test that at both 5 degrees of flexion and 25 degrees of flexion. The reason for both of these is because we have different structural injuries at each amount of flexion. At 5 degrees of flexion, the injuries that we'll see include injuries to the MCL, the medial joint capsule, the pezanserine, or the oblique ligament. At 25 degrees flexion, we are seeing specifically MCL injuries. For lateral plane injuries, we're looking at the LCL sprain. It will be assessed with a varus stress test at those same degrees as we did with the MCL, 5 degrees and 25 degrees of flexion. At 5 degrees of flexion, we're looking at structural injuries to the LCL, the iliotibial band, biceps femoris, lateral joint capsule, and the arcuate complex. At 25 degrees of flexion, the LCL has been isolated. In the anterior straight plane, we see injuries to the ACL, specifically ACL sprains. The assessment can include a 30-degree flexion Lockman's test, the 90-degree flexion anterior drawer test, or several others that we will discuss later. The structural injury obviously is to the ACL. One thing that needs to be considered is if the individual has tight hamstrings, it can give a false negative to an ACL test. Posteriorly, straight plane wise, is going to be damaged PCL. The assessment can include things such as the Godfrey's 90-90, the posterior drawer test, and the SAG test. Again, that structural injury is to the PCL, and having tight hamstrings can also give a false negative. Rotatory instabilities combine two straight plane injuries. The anterolateral is going to be looking at the anterior cruciate ligament as well as the lateral collateral ligament. It will be assessed through a lateral pivot shift test. We can also do the Slocum ALRI test, in which the foot is at 25 degrees of internal rotation. We can also use the standing crossover test. With an anterolateral injury, this is going to be characteristic of an anterior inferior subluxation of the lateral tibia condyle on the femur. Therefore, the structural injuries will include things such as the ACL, LCL, the lateral joint capsule, the iliotibial band, and the biceps femoris. For anterior medial problems, this is going to result from an anterior external rotation of the medial tibia condyle on the femur. The assessment includes a Slocum ALMI test when the foot is rotated to 15 degrees of external rotation. Structural injuries include the ACL, the MCL, medial joint capsule, and the Pizanserine. You may also include a medial meniscus with an ACL and MCL, and then you have something known as the unhappy triad. For posterolateral instability, we're going to use a Hughston rotatory test. Now, these injuries are going to occur when you have a sudden anterior medial force that brings the knee joint from near full extension into hyperextension. So the injuries that you will see include injuries to the PCL, the LCL, the biceps femoris, and the arcuate complex. The posterior medial or PMRI instability is going to be assessed with a Hughston rotatory test as well. The medial tibial plateau shifts posteriorly on the femur and then opens medially in this type of injury. So the structural injuries are to the PCL, the MCL, the oblique complex, and the semimembranosus.